Hello, everyone. Thank you for being here. The topic I have chosen to speak about is a rare genetic gene that I have, which is called mccunes Albright syndrome, MAS for short, which is not inherited by their parents. MAS affects both males and females in equal numbers, 1 in 1,000,000 people, which makes it an extremely rare disorder that classically affects the bone, skin, and endocrine system. Individuals in the general population, because the disorder is so difficult to diagnose, it is believed that the mutation would be lethal if it is affected by all cells in the embryo. Mutant cells can only survive when it is intermixed with normal cells. There is no known risk factors for acquiring mccunes Albright syndrome, and no exposures during pregnancy. There are known to either cause or prevent the mutation from occurring. The disease cannot be and occur equally among all ethnic groups. Affected individuals may often go undiagnosed and misdiagnosed, making it difficult to determine the true frequency of mccunes Albright syndrome in the general population. I remember I would always ask my mom what I was because I knew there were taller people and shorter people, and I was in between. And my doctor would always just say that I was short. So for years, I never really knew exactly what I was until a year or two ago when I finally went to a specialist and they told me my diagnosis. MAS is characterized by fibrosis dysplasia of the bone that occurs with at least 2 additional findings, which are patches of abnormal skin pigmentation, of light brown skin, cafe au lait spots with jagged borders, and dysfunction of certain glands that regulate the body's rate of growth. Also, its sexual development and certain other metabolic functions. Multiple endocrine dysfunction and symptoms and physical characteristics associated with the disorder vary greatly from person to person. The abnormal fibrosis dysplasia weakens the bone, making it abnormally fragile and prone to fractures. Pain may occur in the affected area depending on the specific body cells and tissue that are affected by the genetic mutation. The mutation occurs after fertilization, which is called postzygotic somatic mutation. mccunes Albright syndrome occurs randomly, almost sporadically, in individuals. mccunes Albright syndrome is caused by a mutation in the GNAS gene. The GNAS gene provides instructions for making one part of protein complex called a guanine nucleoside binding protein, or a G protein. In the process called signal transduction, G protein triggers a complex network of signaling pathways that ultimately influences many cell functions by regulating the activity of hormones. the protein produced from the